Dr. Jennifer Villas at KC Dentistry for Kids. Here, we offer patients 3 types of sedation for dental treatment: mild, moderate, and deep sedation. Nitrous oxide is mild sedative gas. It is commonly referred to as laughing gas. Best used for patients with mild dental anxiety needing minor dental treatment, nitrous oxide can help ease a patient into a sense of calm. This type of minimal sedation may be helpful to patients of all ages. Nitrous oxide is administered concurrently with 100% oxygen through a fitted nasal mask. Patients may experience a light floating sensation, tingling in hands and feet, and sometimes a giggle or two. There are no special instructions prior to nitrous oxide appointments, other than avoiding a large meal within the hour approaching an appointment. 100% oxygen is administered to a patient before being dismissed to clear their body of the nitrous oxide. Aside from practicing caution from local anesthetic numbness, the patient can resume normal activities following their dental appointment. Oral conscious sedation is a moderate sedation alternative that is beneficial to patients needing a greater reduction in anxiety than nitrous oxide alone can offer. Parents are allowed with their children for the duration of this appointment. One advantage of oral conscious sedation is that while a patient may be more relaxed or drowsy even, the patient can easily communicate with and respond to the dentist, or the parent in the room as well. This type of sedation does require fasting prior for safety. A child should not eat or drink anything for 6 hours prior to the appointment. We recommend a child have dinner at a normal time, keep a normal sleep time as well. It is important that our patient also be adequately hydrated the night before. Another requirement for this moderate sedation appointment is for a parent to be present with a child for the entire day. Our patient should come directly from home to the appointment and return home to recover from the sedation appointment. In our office, oral medications are administered to a patient an hour prior to the dental appointment. While waiting for the oral medications to take effect, our patient and a parent can relax in a quiet sedation lobby. Once a patient is brought back to the treatment room, nitrous oxide is administered. It is a combination of the oral medications and nitrous oxide that produce a relaxing effect for the patient, helping the patient to tolerate a moderate amount of dental treatment comfortably. Following the dental appointment, patients will need to ease into eating a typical diet. As the patient will be anesthetized for the dental treatment, clear caffeine-free liquids are recommended for the first 2 hours following the procedure. Maintaining hydration is very important to recovering easily from a sedation appointment. A patient can then progress from semi-solid to solid foods, taking caution to avoid greasy foods and dairy products for the remainder of the day. As the sedative medications require a few hours to effectively clear from our patient's body, we recommend a patient and parent limit activities to relaxing and non-physically demanding ones, such as watching movies, coloring, or video games. Parents are encouraged to call our office during and after business hours if they have any questions or concerns regarding their child's post-treatment status or recovery. Please also find the post-op instructions conveniently located on our website as well for further reference. Our office will call you the next day to check on your child. Here at KC Dentistry for Kids, we have the privilege to offer our patients in-office general anesthesia under the care of a board-certified dental anesthesiologist. General anesthesia is the deepest form of sedation. It allows for no sensation of anxiety or pain. Our dental anesthesiologist will administer a combination of anesthetic gases and IV medications to ease patients into a state of deep sedation. Patients will not be aware of or remember treatment being completed, thus making general anesthesia a compassionate and non-traumatic way for some of our patients to complete dental work. Patients with severe dental anxiety, patients who are very young, patients with a large extent of needed treatment, patients with special needs and sensory conditions all may benefit from having all dental treatment completed in one general anesthesia appointment. General anesthesia appointments do require medical clearance and fasting for the safety of the patient. A few days prior to the sedation appointment, we invite parents and our patient to come into the office for a check of vitals and health status, along with a detailed timeline for fasting. There are specific and different cutoff times for full meals, non-human milk and formula, breast milk, and finally for clear liquids. These fasting guidelines must be strictly adhered to for the safety of the patient. If for some reason these guidelines cannot be met, a patient's general anesthesia appointment may need to be canceled. Parents are encouraged to contact our office as often as needed to clarify any pre-appointment guidelines and restrictions. General anesthesia appointments are the only ones at KC Dentistry for Kids during which a parent is not able to be with the patient during the procedure. This is for the safety of the patient. Parents will be invited the moment a patient is moved to the recovery room to comfort their child. Post-op instructions will be given both in writing and verbally to parents the day of the appointment. It is very important a parent is able to be with their child for the entire day of the dental appointment. A patient must come directly from home to the appointment and return straight home to recuperate following the dental appointment. Again, a timeline will be given for when certain foods and beverages should be reintroduced to the patient following the general anesthesia appointment. Parents are encouraged to call the office during and after business hours with any questions or concerns regarding their child's recovery process and status. In the case of a true emergency, parents are advised to call 911 from home. Post-op instructions may conveniently be located on our website for easy reference as well. Here at KC Dentistry for Kids, comfortable dental care is our priority. We look forward to working with you and your child.